Ladies and gentlemen, welcome once again to the Think Clinical podcast. My name is Hamza. It feels so great to be here once again, and I appreciate all of you for all the support once again. I am always looking forward to a week when we can share some ideas. This is again a very important episode that is going to focus on funding your startup. How do you fund your healthcare startup? What do you need to know? What do you need to be aware of when you are trying to get funding for your healthcare startup? Whether you are trying to bootstrap this, whether you are trying to get money from venture capitalists, whether you are trying to seek angel investors, what do you need to know as a healthcare entrepreneur to be able to attract the right kind of investors or the right kind of funding? So I'll spend this episode, I'll try to unpack the different funding options that we have. I'll try to discuss how to choose the right one for your stage or wherever you are in your healthcare business. I'll share some actionable tips to position yourself for success. So these are some of the things I'm going to be going over in this episode, but it's going to be a good one because funding is an important part of the business you run, and understanding where and how to get funding is equally important. So we will go through this, and let me know what you think in the comment section, and if you haven't done so already, please remember to subscribe, like, and share. So we are going to look at how the funding landscape looks like generally, and we know healthcare startups have they are big, they are massive, and they've attracted a lot of investments like in a year. So if you look at how much we invest in healthcare, it's a lot of money. But we need to appreciate the fact that healthcare and funding healthcare technology companies is not the same as just funding an app or funding any other e-commerce platform. There are three reasons for this. One, any healthcare solutions usually will come with a lot of regulations, and this is a long game. Anybody who is going to invest in this, whether it's an angel investor, whether it's a venture capitalist, whether you're going to bootstrap, you need to understand that it's going to go through a period of you trying to get all your research and all your compliance items lined up. So unlike me developing an app, that a social media application that could go to market the next day, healthcare innovations may take longer. So you need to be able to get into a space where you are willing to explain this to any investor, that the long term, the ROI in the long term, for them to understand what they are getting themselves into. That's the first thing that you need to appreciate as far as this landscape of healthcare funding is concerned. The second thing is that they are high stakes, and this high stakes means that anything you do in healthcare development it's a life or death situation. So people would want to know whether the products you are bringing to them to fund or the business you are bringing them to fund is safe enough, and this is going to be a requirement from both regulators and from funders. They're going to want to know, so you have to have this in mind, and this is the second thing that you need to pay attention to. The third thing is that there are diverse business models, so you need to be very, very sure that, and you need to understand the healthcare companies come in so many different forms. They come as biotech companies, they come as medtech companies, they come in so many different forms. So you need to identify where your business falls and identify which funders align with that kind of business idea or business structure that you are trying to put on. So let's break it down. The main funding options that are available to you as a healthcare entrepreneur are three. You either bootstrap, in which case you are relying on your personal savings or revenue to grow the company. So you make money, you put it back in. That's all I have done. I have never worked with any other funding option apart from bootstrapping. A lot of the time is the revenue I generate from any business I do that I invest into the next phase to help the business grow, and I keep doing that over and over again. Or whatever savings I've had over the period, that's what I'm going to put into it. So bootstrapping is one of the main funding options that you can have. The second one is angel investors, and these are usually, they come in the early stages, the early stage investors. And they'll usually provide you some investments for equity. So maybe I'm starting a company, I don't have any savings, I don't have any revenue, I don't have any money to start from it. But we have angel investors who come in early, they identify the potential in the company, they put some money into it with the hope that the belief they have in the idea and in the concept would hold, so that they're able to reap the investment back, and they take back equity in the early stages, so that when the company grows in value, their equity also grows in value and they can recoup their investment back. So that's the second form of funding. The third one is venture capitalists. So these are large investments. They come in and they put in a lot of money, but they will mentor you. They have connections in the industry. They will make sure they position you such that you are able to succeed and grow to the point where they can also make their money back. So it depends on which stage of your business you are. When you look at all these three options I've chosen, I'm going to walk you through how you choose the right funding for your path, because you never know what you're going to do or what you've started doing. So you have to be able to identify the pros and cons of each of these, and you have to also look at the stage of your business where you are. Let's look at bootstrapping for now. Bootstrapping usually best for early stage business when you have very limited capital. So the little savings you have, you put it back in, you make some revenue, you put the revenue back in, you make some more revenue, you put some more revenue back in. So usually for just early stages. This gives you full control, and I think that's the reason why I have leaned more towards bootstrapping in previous businesses I've done, because it gives you more control. There's no dilution of any equity. It's all yours. It's your money that you put back in. So if the company or the business collapses on you, if it succeeds, it's everything's on you. So that's the advantage of it. The cons is that growth is always slow, and it's way slower than you think it is if you don't have any external funding. And that's usually the pitfall, and that's a challenge that I have seen, having done this so many times in so many different ways. So an example again, apart from mine, is Terigi, which is a pharmacy tech company. They started bootstrapping and focused on just generating early revenue before they seek any external funding. So you can do that at the beginning, but if you want to grow faster or grow beyond a certain point, you need to go in and get more investments. 2, angel investors. So angel investors build a strong foundation for your business. So where do you think they come in? They are usually best for startups that need capital to develop a prototype or achieve proof of concept. So you are trying to build a prototype for your business, or you want proof of concept for your business. Those when those angel investors come in. What are the pros? They will often bring industry expertise and mentorship. They will usually come to you because they have been exposed, and they can come to you and bring you some mentorship and bring you some expertise and bring you some industry, teach you where all the landmines are. The cons of it is that you have to give up equity early, and usually you take a significant amount of the company, because at that point it's really worth nothing. So they want to make sure that either when it's worth something, they really make all their money back, or when it's worth nothing, at least they tried. So we'll talk about something like which I mentioned in my previous one, and they secured angel funding to be able to build their initial platform and just to demonstrate patient outcomes. So when you're looking to something just for you to build a prototype or build proof of concept, angel investors are the best. Now, where do venture capitalists come in? They are good when startups have proven the model and they have actually gained significant traction. So that's the third stage. So it depends, each of these come at different stages of your life. So you're able to access large capital, but you're also able to get a lot of strategic guidance, because they're able to help you navigate where and how to move in the system. Now the cons is that they have very high expectations of return. So you may lose control of your company, because they will start telling you what you need to do, because they put a large sum of money into your company. So you may lose a large part of your company. Tempus is an example. They leverage AI in precision medicine, and they've raised a significant amount of VC funding. I never mentioned this in the beginning of the podcast, but this is a good time to mention that grants are also an option. And usually research heavy startups would benefit from grants, especially those that are tackling public health issues, because a lot of what people are doing here are not public health oriented and research type. That's why I did mention that grants is also an option, because the pros is that you don't have any equity loss, but you still get validation for your innovation because you have the capital too. And the cons obviously is that you're not the only one who wants free money. Everybody else wants free money, so everybody's going to be coming after that fund, right? Because they can only give it to one person. So those are some of the things that you need to look at it for. So how do you prepare for investment? So you need to be able to prepare your company to attract the right kind of investor. The first thing that you need to get in line is your pitch. Your pitch should focus strongly on the problem that you are solving. It should focus on the traction, if you've made any traction you've made, whether it's clinical results, whether it's partnerships. You should be able to get all those ones together. And then the third thing that you need to do is that you need to be clear about your financial needs. So I remember the first time we pitched here in the US, me and my partner, the question they usually ask is that they usually say, what's your ask? And we would go all over the place and telling them all the things that, and all they needed to know is, what are your financial needs? That's all they needed to know. And you need to be very specific, you need to be very assertive with what you need, and you need to be very convincing that once you get that, you should be able to perform the way you would. Now you should be able to build a team. That's the second thing. So get your pitch together, make sure your pitch is as clear and ready to go as it can be, and then you need to build a very stellar team. And once you have your team together, you need to understand your metrics, because as a business, you need to be able to demonstrate to investors that you understand what you are supposed to be looking for, that would inform whether or not as a company you are growing or not. So you need to be able to clearly define your KPIs, your key performance indicators, and be able to make sure that you communicate those directly, so that investors understand that you are just not going to be running the company on luck. You are going to be looking at specific things that would inform specific decisions at specific times. And then you need to also make sure that you address risk proactively. The risk in healthcare businesses is high. You need to make sure that you are ahead of regulatory stuff. You need to be ahead of competition. You need to be ahead of any scalability issues, and I will talk about scalability in other episodes, but these are some of the things that you need to have properly honed in. Now, when you look at the challenges and lessons from just how you look for funding, one of the big, I'm going to talk about just three, but because there are a lot of challenges, but I'm going to just highlight three which people would face when they are. One, when you're trying to and that will be the most difficult day of your life, when you're trying to convince investors of long-term ROI. See, investors want to put their money in and they want to see a return on their investment as soon as possible. But when you have to, and as I said in the beginning, healthcare startups are unique. So when you're looking at long-term ROI and trying to convince an investor to keep investing in your company for a long time before they can get a return on their investment, that's one of the most difficult things you would ever have to do when you're seeking funding. The second thing is when you try to balance growth with compliance. So investors need their money. So whenever they invest in your company, they're going to push you for rapid growth. But you also need to prioritize compliance. You need to make sure that you're compliant at each point and you're dealing with that. And the third thing, that you need to be dealing with rejections. You need to be ready to deal with rejection. That's one of the biggest challenges most healthcare startups are not able to withstand. But rejection is going to be a part of your journey, and you need to be ready to deal with it when it happens. Now, these are some actionable items that you can move with, and there's just three. One, make sure you start small but think big. Don't be afraid to bootstrap in the beginning. Don't be afraid to put the little money you have, make little revenue, put that back. Don't be afraid to start small. But as you do so, they would eventually lead you or position you in a place where you can win big. But continue to dream big, continue to think big at all the time. The second thing is that you need to leverage your networks, because When you join things like healthcare accelerators, they actually open you up. And they open you up to networks that you would need to be able to scale your business. When you're able to attend pitch events, it helps you to meet potential investors or people who will be able to guide you on how to properly deliver a pitch. You need to connect with industry leaders. Networking is very important. So first of all, start small, but make sure you think big. And secondly, make sure you leverage your networks, and then just stay patient-centric. That is something I always keep telling all healthcare. Once you stay patient-centric, you will be fine. Funding would continue to be one of the most important and one of the most crucial elements of any business and any startup. But your ability to think about all these things we discussed today and apply them is what will put you in the position of success. This has been another exciting episode of the Think Clinical podcast. Thank you once again for joining us. We appreciate you and have a great weekend.